Hello, everyone. Thank you for joining us today. We appreciate your participation and continued support of our events. So I just want to, apologies for the slightly late start. We're just finalizing a few things, but we can get ready to start now. My name is Paul Sherman. For those of you who don't know me already, I'm the Senior Programs Manager for SID Washington. So I help to put on all these events. But first of all, I want to start off by thanking our co-chairs for this event, for helping us to put it together. Mark and Sabrina for the Food Security and Agriculture Work Group, and Jamila and Cheesy for the Young Professionals and Development Network, particularly Jamila, who came to us with this idea in the first place. So thank you for that as always. And then, of course, our panelists here, thank you for taking time out of your really busy schedules. I know it's a really crazy time for all of you. And thank you for all the work that you do. But we understand, but we really do appreciate the time you're taking out of your schedules today. For those of you who don't know who we are, we're a memberships and events-based organization, and we host a whole wide variety of events. That's kind of our bread and butter, events like these. We have two currently on the schedule coming up over the next 2 weeks. One that's on resilience in the job search, and then one that's on the future of project implementation in the international development industry. That's on May 28th. So that should be a very interesting conversation. That is a chapter event only open to members. So if you are currently a member and would like to join us, please feel free to sign up on our website. We do have several events in the works for June, so please check out our website for more information about those, or stay tuned. We should have more information about those within the next couple of weeks. And that is enough of me talking. I will hand it over to Mark Castellino to get us started today. Just a few brief notes. We will have everyone muted except for the panelists, SID staff, and the co-chairs. And for those who are joining us via phone, if you're having difficulty finding the mute option or for muting your microphone, it's *6. So for those of you who are joining us via phone. And with that, now I'll hand it over to Mark.
Thanks very much, Paul. Hi. On behalf of my co-chair on SID's Food Security and Agriculture Workgroup, Sabrina, and the co-chairs of the Young Professionals in Development Network, Jamila and Chizzy, I'd like to welcome you to our joint event. Our subject today is a little different to our usual focus on international issues, but we are living in unprecedented times, and the impacts of the COVID-19 pandemic are being felt all over the world. And it's also touching all aspects of our lives. Food systems have been particularly effective. Only 3 months ago, none of us would have expected to be lining up outside grocery stores or going in to find empty shelves. The idea for this event came up as some of my co-chairs and I were discussing the dramatic increase in the demand for food and nutrition services here in the DC area that we were hearing from some of the organizations that we support and volunteer for. And we suspected that there was probably a lot of people like us who work on international food security and agriculture issues, but are also interested and committed to local hunger and nutrition issues. We thought now, more than ever, our SID Washington community would want to hear and discuss how COVID-19 is impacting our international work, as well as impacting our neighbors here in the DMV. And we wanted to give the opportunity to hear from the great organizations that are responding to those food security issues overseas and here. Our panel today is moderated by Rebecca Middleton, who is the Executive Director of the Alliance to End Hunger. And I cannot think of a better person to guide this discussion because Rebecca leads an organization that works across both the international and domestic food security sectors. The Alliance to End Hunger engages diverse institutions to build the public and political will to end hunger at home and abroad. And it's a coalition of over 90 members representing corporations, non-profits, faith-based organizations, universities, foundations, international organizations, and individuals. Rebecca spearheads the Alliance's advocacy on international food security issues, such as the great work that they did in supporting and pushing for the successful authorization and reauthorization of the Global Food Security Act, which has been critical in improving and elevating USAID's food security work around the world. And Rebecca is also a leading voice advocating for our domestic hunger programs, such as protecting the Supplemental Nutrition Assistance Program that provides a critical safety net for millions of low-income Americans. Prior to joining the Alliance, Rebecca spent more than a decade in government relations at Cassidy and Associates here in DC. And before that, she served as senior legislative assistant for Representative Frank Wolf. I can't wait to hear from our panel on what is a timely and important discussion. So now I'll hand over to Rebecca to lead it.
Thank you so much, Mark. And I really appreciate SID hosting this and you for inviting me to moderate. I know we've all been on countless webinars, meetings, but this one is particularly exciting for me because it is the first that I've seen that's bringing together a conversation around the incredible needs both at home and internationally. I think very often that conversation is set up as two separate and sometimes even competing camps, but as Mark shared, the Alliance's view and mine personally throughout my interest in hunger issues has been that it's an and that they're connected. And so I'm really grateful to have such a strong panel and the opportunity to talk about this today. So just a few things procedurally, we're going to obviously have a bit of a structured session, but really are looking for those of you who are joining us to bring your questions in to make this as rich of a time together as possible. So I will introduce the panel. We've got a couple of opening questions to frame the context and give you all a baseline on sort of what's going on the front lines right now. We've seen the news articles, as Mark said, of the lines at the food pantries at home, and we've seen the articles about the dire warnings and even some of the immediate impacts internationally. But it'll be really good to hear from our panel who is most deeply connected to those in need right now. And then we'll move through 3 rounds of questions. Then we'll have audience Q&A. As Paul said, please submit your questions through the chat on here, and then I'll be able to ask them to the group. If you want to target them to one speaker, please indicate that. Otherwise, we'll probably take them in groups of 2 or 3 for the group as a whole. And then we'll wrap up with a closing of sort of call to action, and we will look to wrap by the scheduled time of 1, just being respectful of everybody's time. So with that, we'll get started. I'm not going to read full bios in the interest of time, as I know that they were on the invitation and the flyer in advance, but really excited about the 4 folks we have joining us today. We have Jim Flock, who's Chief of Party, Feed the Future Tanzania, NAFAKA2 activity for SID-Boca. I hope I said that right, Jim. If not, please correct me when you speak. We have Carrie Stolzfus, who's the Executive Director of Food and Friends, Radha Muthai, who's the President and CEO of Capital Area Food Bank, and Kim Ford, President and CEO of Martha's Table. So we'll get started. First of all, with who is being impacted and how they're being impacted. And as we start with this question, I know the panelists will also talk a little bit about their organizations and their work. But we're going to go macro with international down to local. So that means that we get to start with Jim. So I'll turn it over to you, Jim. Thanks.
Hi, Rebecca. Thanks. For SID-Boca, we're a global NGO that deals with food security, resiliency, and market systems facilitation primarily in the agricultural sector. The NAFAKA, Nafaka, actually means cereals in Kiswahili. And so what we've been doing since the pandemic started is we've seen the impact on 3 primary levels. Obviously, there's various nuances to it, but what we've been dealing with is first and foremost on the farmer level. If you look at it, and I'll talk more in macro terms in terms of the East and Southern Africa region and other experience I've had over the years, but farmers are entering into the harvest period right now. And so their work in terms of a potential surplus in markets where the hospitality, school feeding programs, similar to what you're seeing in the US, those markets are being closed down. So we're looking more with government relations and buying and moving commodities across borders. That not only affects the farmers in the short term, in the medium and long term, what you're seeing, which has kind of a global impact, is mining sectors for things like fertilizers, for ability to produce crop protectants, for the upcoming agricultural seasons globally, those are seeing limitations in terms of mining, production, and distributions within the supply chain. Notably for fertilizers, the one we're most concerned about, as we have a lot of products that come in from China, India, in regard to fertilizer production. And so we see those being not only having limitations in terms of productivity, but also in terms of port and transportation through markets. So those are the main ones. The other one that I think reaches across is with school feeding programs, certainly in the emerging markets and developing nations. A lot of school feeding programs are focused on nutrition, nutrition facilitation, working with millers and processors. So with those school feeding programs, there's a lot more work in terms of SMS, in terms of working with farmers and doing mass communications to help them understand where high nutrient products are available and what the schools have been providing to their children. So there's not a drop-off, an immediate drop-off in terms of providing high nutrient meals, which I know is something that's also being affected on the domestic market. And thank you for the invitation, and thank you for inviting me today, and I'll sign off there.
Thanks so much, Jim. Carrie, now over to you. What are you seeing on the front lines, and who is being impacted, and how are they being impacted?
Hi, everyone. So let me just say a couple things about what Food and Friends does to put that in context. We deliver medically tailored meals. Our clients are referred to us by their healthcare provider, and they're living with really serious illnesses, heart failure, kidney failure, all types of cancer, folks with poorly controlled HIV and AIDS, really all the illnesses that you're seeing, that you're reading that put you at higher risk for COVID. And so our clients were pretty vulnerable, a lot of times frail before this all started. And just the issues that they're facing are, even more acute now. So, I definitely think that the people who were really struggling with their health, it's just that much harder for them to navigate this. And the need for them to isolate is even more important than it is really for all of us. And also, a lot of them are losing access to their care providers, as all of what's being called non-essential care is still being delayed throughout most of the country. And that's definitely an issue. But in addition, I think it's a pretty tough time to be a caregiver right now. If your loved one has a serious illness, they're also being impacted. We're seeing a lot more referrals than what was typical for us. And I think a lot of people who are living with a caregiver who was maybe able to help out, do some shopping with them beforehand, those caregivers are also really concerned about isolating in order to keep their loved ones safe. So a vulnerable population that's becoming even more vulnerable in this current crisis.
Thanks so much. Carrie, no, that was Carrie, sorry, Radha, we switched the order around and I have my notes numbered but not in lines. Radha, at Capital Area Food Bank, I can only imagine what the last couple of months have been like. So who's being impacted, particularly who's new that's being impacted, and how in general is the community that you serve being affected?
Great. Well, thank you for hosting this, and I know you do most of the work on the international dimension, so it's great to be able to tie in the issue of food insecurity globally as well as locally, and a pleasure to be here with Carrie and Kim, who we work with so closely as partners in our local network. So maybe just to set the stage a little bit, there are about 400,000 food insecure individuals in the greater Washington, D.C. area, and this covers not just the entire District of Columbia, but Northern Virginia, as well as Prince George's and Montgomery County. So I have to say that statistic, I may say it a million times over the last few years, but it always surprises me in terms of just how large that number is in the capital of one of the wealthiest nations in the world. So that was the situation prior to COVID hitting. And these are not just homeless individuals, right? There's always an assumption here and a false one in terms of who might be food insecure in our area. In fact, the majority of the individuals are working multiple jobs. They're often minimum wage, inconsistent, and we have food insecure individuals in every single zip code in our area. So it's not to say that, oh, there's certain zip codes that are wealthier ones, if you will, and there are no food insecure folks there. that's a fallacy. They're in every single zip code and across the age spectrum. And as Carrie mentioned, lots of unique needs. Those who are ill and are chronically ill and have special needs, to those who are, juggling multiple jobs and just, some have food stamps, some don't, and they're just trying to meet their nutrition needs. So as a food bank, we provide a little over 30 million meals each year, and we do that directly, but as well as through a network of 450 partners. And we're so thankful to have Martha's Table and Food and Friends as part of that network as well. And so you can think of us a little bit like a wholesaler, if you will, that is providing food to these end partners who are distributors, who are getting the food out to those most in need. So that amounts to about 84,000 meals a day in terms of just the quantity of food that's being provided through the network. So I wanted to set that stage so people had some perspective on that. So what's changed with COVID? What we're seeing is our partners are telling us anywhere from a 30% increase to a 400% increase in terms of the number of individuals who are coming to their pantries, to their organizations in search for food. The other is that we're seeing the amount of food that each person is asking for go up. And there's a reason for this. So typically, people come to the food bank and its network for about 3 to 5 days worth of food each month. So it helps close the gap. But with public health guidance suggesting we keep 1 to 2 weeks worth of food at home, just with that existing 400,000 base, you've seen an increase in demand. And then, of course, with the unemployment that is occurring and rising, we're seeing so many more individuals who are new, who've never had to navigate the food assistance network that Carrie and Kim and we are all a part of, who are calling us. And so we have something called our Hunger Lifeline, and that has the calls into that Hunger Lifeline have seen a 310% increase since this pandemic started and since the economic slowdown started. So the demand is there through a variety of different sources, and it looks like it will continue for some time.
Thank you so much. Kim, are you someplace where you're in a good spot to talk? I know you were in transit a bit earlier.
I'm here.
Fantastic. Hello.
Hello, hello.
What's going on at Martha's Table?
Well, welcome to Martha's Table. We are open, we are rocking, we are rolling. Just want to thank you guys so much for including us in this discussion. Certainly want to thank our great partners, RADA at the Capital Area Food Bank. I mean, we just couldn't do it without them and everybody else. So I think that the question that's posed is what are we seeing on the ground? And what I would say is when RADA talks about 30% to 300% increase, we're at we're at beyond a fourfold increase at this point. We like to say quadruple because none of us can really pronounce quintupled appropriately. But we've really gone from about 500 bags of groceries a day to well over 2,000 and over 2,500 a day. And we are open at our lobby markets Monday through Friday, 11 a.m. to 4 p.m. in Southeast and in Northwest. Due to the demand, we actually introduced 10 community drop-off sites in Southeast. We have hundreds of bags of groceries that are going out via that. We have hundreds of bags of groceries that are going out directly to affordable housing units and senior housing units for those who can't come out. We have 5,000 box meals that come in every Saturday that we actually distribute right back out on Saturday through our channels and also through partners. We have hundreds of hot meals that come in every day. Of course, our McKenna's Wagon, which is our longest standing program, goes out every night. This year, 366 days a year. It doesn't matter holiday, doesn't matter weather. Goes out every day to provide a hot meal to those who are facing housing instability. And we've seen that grow from about 125-ish people a day to well over 200 a day. And so the demand is just jumping off the charts. And what we're hearing on the ground is a lot of people who are saying, and it pains us because we have a lot of people who are saying, I lost my job, my hours got cut back. And they say, I never thought it would come to this. And we've never seen ourselves as like a last resort. We've always seen ourselves as providing access to healthy vegetables, healthy produce, healthy fruits and shelf life items. But, you know, a lot of people have been coming to us saying, I never thought it was going to come to this. And that's a huge part of the influx is, you know, you have to think about Maslow's. First, you have to take care of shelter, and then you have to get to food. And so folks are coming to us for food. We've relaxed every restriction we ever had. We used to have something where you could only shop at our lobby markets once a month. That's completely waived, so you can come all day, every day. We're open again Monday through Friday in Northwest and Southeast. In Southeast, we're also open on Saturday from 10 to 2. And that's just a part of what we're doing. We're doing a lot of other stuff. I'm sure we'll get to it in other questions. But as I walked in here today and just see, you know, a ton of volunteers, which is great, you know, because we've moved out of obviously our lobby market model where people come in and shop. We've moved into a pre-bag model where all the groceries are already there. So it's a grab and go model. That takes a lot of people power. And so we're just so grateful that we have volunteers who are sticking with us, who are helping us do this and move, again, you know, 4 and 5 times more than we were accustomed to. And we're so happy again to have partners like Capital Area Food Bank, who's helping us with the increased demand.
Thanks, Kim. Appreciate that. Before we jump to the second round, I just want to remind folks who are joining us, if you have questions for the panel or for any individual panelists, please put those in the chat section of the window, and those will get filtered in here, and we'll get to those in a bit. But I first want to talk about, you know, it's been this sudden triple shock of spiking demand, you know, the public health crisis, and then of course disruptions to supply chains. And I know that that's affected each one of your organizations in different ways, but would just like to dive a little bit more into how you and your organizations are responding to this unprecedented need in this unprecedented time. So again, we'll start with Jim.
Okay, thank you, Rebecca. In regards to the disruptions in the supply chains, I mean, just 2 of the things that we're working on is a lot of government communication in regards to just easing restrictions on travel, but also putting safeguards in place in regards to rapid testing, or informing us on how they're doing that type of rapid testing. We're also, from the ag perspective, we're already having discussions on what's called substitution effect. So this feeds into a bit of organic versus commercial farming, but you would look at using manure and things like that, and crop protectants, you would look at more locally sourced materials. In the commodities perspective, you look at a lot more of the indigenous crops that might be available instead of other crops that might be coming in for import or through export markets. So that's where we're having these discussions. We continue to have discussions with the major agricultural actors, be it Monsanto, Syngenta, Corteva, Yarrow for fertilizer, just to understand those disruptions and to manage expectations appropriately. And then as we see where the surplus and the harvest comes in, or how commodities are moving, we're able to kind of help inform farmers and inform their decision-making processes moving forward into the upcoming input supply season. And then from the millers, we're doing a lot more in terms of communications to get to more last mile locations and to kind of relook at supply chain channels where we go to school feedings, go to hospitality sectors, and trying to redivert them into last mile market actors, or what we would consider last mile market actors. So more of these local shops, these kind of retail shops at the village level, so that as these commodities become scarce or not as readily available through the normal channels, farmers are able to access that, the population is able to access that, and have a better sense of where to procure these items.
Thanks so much. No, that's great, Jim. I'm sure we'll probably have some questions later and more time to chat on that. So Carrie, you know, how are you responding, adjusting, changing, ramping up to meet the demand, particularly given how impacted the population you've always served is as far as being at high risk with COVID-19?
Yeah, you know, we've also experienced an increase in demand. We're delivering about 5,000 to 6,000 more meals per week than we were pre-COVID. So just for context, we were at about 22,000 meals per week. Now it's more like 26, 27. And our meals are prepared by our chefs and volunteers here on site. These are prepared meals because our clients aren't well enough to cook on their own. And so we've traditionally we have 11 meal plans that are medically tailored based on what the person's illness is, kidney failure, diabetes, etc. We're doing as much streamlining as possible as we can to keep what they're receiving in line with their nutritional needs, while also trying to relieve some of that burden of that extra volume on our chefs and volunteers. We've had to really completely rework our delivery model. We're delivering once a week. We used to come out 3 times a week. So everyone's getting the same amount of food. 18 meals a week is what we provide, but it's coming all at once and it's frozen. So we've had to make a lot of changes. You know, we've got a lot of huge walk-in, you know, cold storage spaces. And right now the freezers are packed to the gills. We've got some freezer boxes in the parking lot that we're renting. And the fridge space is being underutilized. So we're trying to work with, you know, just some vendors to get some of that changed over so that we, you know, can continue to do things this way in the longer term. We've also had to adapt to working with fewer volunteers. We're a volunteer-driven organization, just like my partners on this panel. In a typical year, we'd have about 8,500 people come through our doors to help us do this work. And now we can only have as many people as can be in a workspace 6 feet apart. So all the tables are marked. Staff are monitoring to make sure distancing is being followed. So we're working longer hours with fewer volunteers, providing more meals, and delivering only once a week. We've also started doing no contact deliveries, which is a little heartbreaking when your agency is called Food and Friends. So we're still, you know, knocking on the door, but then stepping back just to check in and make sure the person is home and well and able to get to the door, but not that same, you know, stand and talk on the porch or at the door model that we had before. So.
Thanks, Carrie. Radha, obviously, you know, getting food to people through big supply chains is something that you all, you know, have the core of your business, but I'm sure that that's been changed significantly. You want to talk a little bit about how you're doing things differently and, you know, how you're responding to these triple challenges right now.
Yeah, thanks for that. And, you know, I would say that we are looking at, you know, at this period and what is likely to come forward in 3 distinct phases. So we're very much in the response phase, but we will be moving fairly quickly into what we're calling the recovery phase and then the rebuilding after that. And I'm sure many of us are thinking about things in fairly similar ways. So I'll speak to the response phase right now, because I think that's where your question is, and then later on, if we have an opportunity, we can talk about the other 2 and what the outlook for the next year plus looks for us. So as the largest provider of food in this area, we are looked upon and expected to kind of be ready and to be nimble and to be able to alter, if you will, our operating model to be able to meet these changing needs in the community. And so we, I'd like to say we had a trial run during the federal government shutdown last year. And, you know, it obviously there's so many differences this time around from then, but it did get us sort of up and ready to be able to just pivot, you know, within a day or 2 in terms of switching operating models. So a few of the challenges that we're experiencing are similar actually to what Carrie mentioned, so I won't repeat those, but the social distancing and the volunteers, all very, very similar. But I think maybe a couple of the different ones might be that we, as I mentioned earlier, work through a network of usually about 450, 460 community-based organizations. Half of that network is not functioning and has not been functioning for the last 2 months. Many are served very well by senior volunteers, and obviously they are in a vulnerable group and have not been able to perform those functions. So we have actually been getting out more food with just about 40-45% of this network functioning. And so what that has suggested and what we've had to do is just create different hubs around the area, do pop-up pantries, you know, have these drive-through models where we've packed, you know, boxes of shelf-stable items, put them in people's trunk as they go through, and have those pop-ups be in food insecure areas within our region. And so we use a lot of data to understand where our food insecure clients live, and so we use that again to be able to determine where these hubs and pop-ups are Martha's Table actually is one of those hubs. And as you heard from Kim, their demand is increasing. And as a result, we're providing, a lot more food to hubs who are able to take it as well. The other big thing for us is that our model is predicated on significant food donations. In, pre-COVID, we would get 60% of our food donated through retailers in the area. So pick your favorite grocer. I guarantee you they donate to the food bank, and they're very generous with their food donations. But within 3 days of the pandemic hitting in early March, we saw a 75% decline in the amount of food that was donated to us. And as Mark mentioned at the beginning, who would have thought that we would be lining up in the nation's capital to enter a grocery store, and when we're there inside to see bare shelves. And so those bare shelves translated into this decline in terms of food donations for us. So we had to pivot and start to purchase hundreds, literally, of truckloads of food. And that is, to put it in perspective, what we purchased in April is over 3 times what we purchased the entire last year as a food bank. So because of this decline in food donations, we have had to purchase just millions of pounds and millions of dollars worth of food to be able to ensure that our inventory was, let alone the demand that we've all been, the increase in demand that we've all been speaking about already. So that has been significant. And we anticipate in conversations with grocers that the level of donations that we used to get will not return until about December of this year. So we're looking at another 6 months plus of having to purchase hundreds of truckloads of food. The other thing I'll say, and we've been hearing about this in the media, the supply chains, the global supply chains for food, the national supply chains for food have all been impacted. 53% of the meals that we as Americans consume, are outside of what we purchase from grocery stores. It's what we purchase from food trucks and restaurants and cafeterias and et cetera. And so the global and national supply chains have all been geared, 53% towards those entities, restaurants and the like, which obviously have shut down or are in far, less need for food. So it's taken a few weeks, or even a couple of months now for those supply chains to pivot, back to grocery stores and to organizations like food banks. We are working very closely with many large food producers, farmers, et cetera, and through USDA and the new Coronavirus Food Assistance Program, that is about to kick off next week or so, within the next 10 days. And that will help further orient and provide food from farm to trunk, which I think is the tagline that USDA is using for this program. And that will help sufficiently because it's produce, it's protein and dairy that is all good and the right types of categories, food categories that we need to be providing to our clients.
Thanks so much. So Kim, you started talking a little bit about what's going on in your neck of the woods, particularly with the reduction in volunteers and inputs at the same time as there's such a spike in demand. Can you talk a little bit more about how you're responding and what's helping, what's working, and some of the things you've learned?
Yeah, so a couple of things is, we've changed a lot of our operations. I think I mentioned earlier, we've moved to a pre-bagged model, which again, it takes a lot of people power, but it's just the more effective, efficient, and appropriate thing to do. So again, it limits contact, it limits time, but it takes a lot of people to actually bag. So we have fully committed to keeping the entire team on the team. We've also required mandatory telework. We are not reducing anyone's salaries or benefits or cutting anyone's hours, but you have to actually opt in to come into work. Not surprisingly, we have not a large number of people opting in. Our volunteers kind of ebb and flow. We've had to look at very specific partnerships, and I want to give a shout out to Serve DC and the mayor's office, who sent us an amazing organization called Team Rubicon. They're here today. They're here every day. And those are men and women who have served in the armed forces, who respond to disasters. And that's really been kind of keeping us afloat. We have more and more volunteers who've been coming. The past couple of weeks have been good in terms of like volunteers starting to come. A lot of places, Rada mentioned, like they've shut down. So places where people normally volunteer, those opportunities don't exist. Here, what we've done also is we've consolidated our operations. Most people may know that we have 3 locations, but our largest location is our headquarters, where we have the biggest amount of space. So we actually have consolidated all the back end efforts here. And so we have the ability, I mean, every volunteer orientation starts with airplaning. The way that you even bag the groceries is beyond socially distanced. We have X's and cones and everything where people line up. It took, and I'll just be honest, it took a couple of weeks for folks to follow it, but people are following it now. And so whether you're at our Northwest campus or our Southeast campus or at our community drop-offs, you do see people who they stand where they're supposed to stand. And if for whatever reason someone's not where they're supposed to be, we do have a team member who goes out and politely, respectfully, and with dignity says, you're gonna have to back up. McKenna's Wagon, as I mentioned, that supports those who are facing housing instability. We changed our model there. We used to do, our chefs would make the meals, we'd scoop the meals out, so you would stand there, then you would go get your sandwiches, then you would go get your drinks. Now everything is in one bag. So again, it's a grab and go, boom, 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 we move. I was on McKenna's last night, and actually one of our guests said, he was like, man, before we used to have to wait in line forever, and now everything moves in less than 5 minutes. So we've made a lot of operational changes there. The one thing I just want to say also about supply chain, or a couple of things real quick, for us, the supply chain issue hasn't been getting the food. It's that we're ordering so much more food and it's coming less often. And so you can imagine that if, we used to order for 500 bags of groceries, and now we're ordering for 2,000 per day. And now you're not coming 7 days a week, you're coming 3 days a week. That becomes a massive, voluminous delivery, which also requires a lot of people power. The other thing, and I don't want to speak it into being, but I'm already starting to see it. And Rod, I don't know if you're seeing it, and Carrie, I don't know if you're seeing it, but food prices are starting to go up. And people think that, like Martha's Table, like we just get food. We don't just get food, we buy the food. We actually buy a good deal of what we're doing. And so, I mean, just small increases, which I actually expect to jump up even higher, is going to become incredibly problematic for a nonprofit organization like us, who again, committed to the team. We're not going to lay anybody off. Our schools are closed. We're seeing revenue losses because, again, with other things that we typically do. But I am concerned about that. And even with what Rada said, I mean, if this is going to go through December with supply chain issues, I mean, they're just going to keep getting tougher to deal with.
Thanks so much, Kim. Before we get to the next round, just want to remind folks to please get questions in on the chat. Thank you for those who have done so, and we'll get to those after this next round, which you all have teed up nicely. And Rada, I really like your framing of sort of the response, recovery, and rebuilding phases that you're looking at. Obviously, the crisis, everybody's been overwhelmed with the crisis mode the last couple of months. I do feel like, as I'm talking to groups across the spectrum, that we feel like we can breathe a little bit now. Not that the crisis is over, but we've figured it out, kind of like Kim was talking about the processes and things like that. So as you look as far as you can on the horizon, whether it's tomorrow or next week or 6 months from now, what do you see in addition to some of the concerns about rising food prices and some of the continual disruptions from the public health? We'll keep going in order just to give everybody a chance to take a break in between their comments. So Jim, what do you see on the horizon from your?
Sure. I think what we see in the short term, the price volatility will continue both in kind of these regional pocket markets, be it in the Africa, Asia, or South Africa, or the US markets. Part of that is we've already seen bits and pieces of that historically with the trade policies going on with the current administration in terms of how they choose to engage with farmers or how markets are going to be opened up. What I see also is that you'll see a lot of what's called rent-seeking actors. You'll see also opportunities as you go further into supply chain or agricultural cycles. You'll see counterfeit products that tend to emerge during periods of crisis or risk emergency. And so I think a lot of things you'll see in terms is verification of quality of product, sourcing of products, being able to identify those origins. So be it farmers or consumers, they're able to do some checks on this and to understand the quality is there and being provided by these organizations. I think one of the other things you'll start seeing as you kind of go into the second phase of this, as Radha was talking about, is market recovery systems. In the US, the Fed's already done a lot of response activities in terms of be it payroll or getting opportunities and getting as much cash into the market to prevent market constrictions. You'll also see that in emerging markets, be it with IMF or World Bank or host countries, national banks, so Bank of Tanzania, Bank of Kenya. And I think what you'll see, be it from private sector, from NGOs, USAID, or donor organizations, a lot of cash influx, which historically you've seen in emergence from conflicts. In the Ebola response, ACD-Avoca itself, and we are part of doing emergency cash transfers. So trying to keep some liquidity in the market so people are able to still operate without a complete recession and hopefully keep it more to a market contraction. So I think cash will be very important. I think being able to track counterfeit type of products. Obviously, I think ICT and the communication that you'll see in emerging markets will continue. Also, e-commerce, B2B type of transactions will also be shifting a lot more, specifically in emerging markets as the IT and the systems and the solutions, people become more familiar with it. And we're already starting to see that right now for the communication. So you're still able to practice some of that social distancing. And I think learn that you can still do some of these things without travel moving forward.
Great, thanks, Jim. Carrie, what about you? What are you seeing on the horizon and sort of starting to focus on now that there's a little bit of space to be able to do?
Yeah, I mean, I'm mostly thinking about, I think we're going to see an increased need for our services for the foreseeable future. I'm sure a lot of you are familiar with all the ways in which food insecurity and chronic disease are linked in our society, and it's a cycle. You know, if you're food insecure, your dietary quality is low, and that makes you more likely to get a serious illness, a chronic disease. That leads to higher healthcare costs. You might be less employable, your income goes down, and that leads to food insecurity. So it's a negative cycle, and I think if we see a sustained increase in food insecurity, we're going to see a higher prevalence of chronic disease. I also think that, you know, again, with all the delays in healthcare, which is a big part of what keeps me up at night, if we, you know, we're going to see more serious outcomes of illness as people delay their healthcare, and that's going to lead to an increase in food security as well.
Thanks, Carrie. Radha?
You know, I want to just piggyback on a couple of things that was said earlier. You know, as we move into the recovery phase, clearly the pandemic will have its course, and who knows, you know, exactly what that will be in terms of the fall and winter versus where we are now. But we are quite focused not just on that, but on the economic slowdown. And so we've been looking very sort of actively at the weekly unemployment claims at the county level, and in some cases down to the census tract level, to better understand those who are going to be unemployed and will also be food insecure, you know, and where that is perhaps reorienting our map in the region in terms of food insecurity. As we all know, not everyone who becomes unemployed will become food insecure. There are many who are at middle income and higher income who are losing their jobs, but we're very focused on looking at those who are making $25 an hour or less, you know, and those industries and where they might be, so that we can better target and understand where the need might be going forward. As we look at some of these numbers, it's becoming evident that we will see an increase in food insecurity, anywhere from 15 to 20% increase in the coming year, and likely couple of years until the economy fully recovers. So when I talked about the almost 400,000 food insecure individuals pre-COVID, we are looking at maybe adding up to, you know, 70,000 or so individuals to that. And so that is an alarmingly high number, but likely, something in that ballpark is going to be realistic for the next year or two. So we are thinking about what does that mean in terms of channels of getting to the newly unemployed and the newly food insecure. As we all know, whether it's globally or here locally, there's a lot of stigma, embarrassment, issues that are associated with now having to ask for support. Kim talked about, some of the folks who are coming to Martha's table saying, gosh, we didn't think it would come to this, and we hear this constantly on those calling from the Hunger Lifeline. Many often start with an apology and saying, I used to volunteer with you, but I'm sorry to have to ask for food now. I mean, it's those kinds of instances. So I think the recovery phase for us, which we're thinking about in the next 6 to 12 months, is better identifying, better targeting, getting the right kinds of channels of distribution that make it as comfortable as possible for people to be able to get the food and so they don't go without. So whether that's language issues, whether that's many who are undocumented, and don't want to come to big public distributions, how do we get things to them, in a manner that is comfortable for them to engage in as well. We will continue to engage in many public-private partnerships. That is something we've done in the past. We'll continue to do that as we move forward. And then I think as we think about rebuilding, that to us it's an opportunity, right, for all of us to rebuild stronger. This shouldn't be a region with vast amounts of inequity. And this is an opportunity in that sense to hopefully rebuild, to close that equity gap. I often say that it's shocking to know that in the Greater Washington area, from where Kim is standing right now at Martha's table to where the SID offices are, because I happen to know where those are in Northwest DC, that span of maybe 10 miles, of distance, that's a 30-year difference in lifespan for those who are born in Ward 8 versus those who are born in the more affluent parts of DC. That's completely unacceptable in this region. And that's where we were, and that's probably where we are at this point in time. So as we think about rebuilding, for us as a food bank, equity is very much at the center of how we need to rebuild. And we think that food has a very important role to play, just as health does, that Carrie mentioned. Carrie, ourselves, and DC Greens are part of a food as medicine, effort here with that links food and healthcare, and that's really important. And as a food bank, prior to COVID, we were moving down this path of bundling food with health, with education, with employment and skill development. Again, not that we as a food bank can provide all these other services, but partnering with organizations that do, so it's easier for our clients who are in need to access all of the support services, in one manner and make it accessible and easy, so that we facilitate those pathways for them to not be on the periphery of the society, but to be very much included in the economic growth that was occurring before and will occur in the future, so that we reduce some of that disparity as we move forward.
Yeah, I mean, and I just couldn't echo this more. So we just firmly believe that economic recovery is going to be the big next step, if you will. So when we closed our schools, so folks may know that we have nationally accredited early childhood education centers supporting young people 6 weeks to age 4. And when we closed our schools, we provided a comprehensive support package to our families. And that package included cash transfers at $750 a week, plus $15 a day for grocery gift cards, plus diapers, wipes, and then formula for our youngest people. Because we knew that our families, first of all, we were changing our contract with them. They planned to have their kids with us. We closed our schools. What are you going to do if you're still able to work? What are you going to do with your kids? You may have to pay for that. You may lose your job. We already had conducted parent surveys, so we knew over 50% of our parents were in the service industry. We correctly and unfortunately predicted that folks would lose their jobs. And so we've actually been doing that now for, I believe, 9 weeks, no, more than 9 weeks. We did 3 weeks, 3 weeks, and 5 weeks. That number, 11. Okay, whatever 3, 3, and 5 is. Okay, 11, right? And we actually did this before the entire national conversation started about cash transfers. And it was funny, I always laugh about one of our parents I saw out front who said, you know, after it started becoming a national thing, they were like, you should tell them Martha's Table started that. And I mean, of course, nationally, we didn't start it, but we did get out in front of that early on, and we've continued to do that. So we stood alongside our team, obviously. We've stood alongside our enrolled families, and that's both center-based and non-center-based. We just conducted another survey with our parents. We have 137 parents enrolled, or families enrolled, that represent 207 young people. Of the 137, over 100 participated in the survey. And I mean, one, that's statistically crazy. Two, just to see what people spent the money on: rent, utilities, transportation to jobs, paying for childcare now that their childcare had fallen through. I mean, and I won't go down this bunny hole, but anybody who studies cash transfers should know. I mean, I know there are people who don't necessarily believe this, but in every study it shows that if you give people money, they will do what's right and best for themselves and their families. And so when you talk about kind of like what's next, we're definitely thinking at Martha's Table, how do we continue to stand alongside our community, a community that already was at only a $34,000 a year median income. To Rada's point, you could skip up the street and be at a $80,000 a year median income. And we know that sitting at the center of health and housing and affiliations with the justice system and everything else, it all goes back to money. So when you look, there's a reason that your zip code predicts or tends to indicate and try to predict what's going to happen to you educationally, economically, and health-wise. And it's not surprising that those zip codes have higher levels of monetary assets. And so we were proud to stand alongside our families. We continue to do that. We're, again, on our third round of supporting our families in that way. We're a part of a consortium now with Far Southeast and B-Bar, Building Bridges Across the Anacostia, and Bread for the City. We're part of a consortium that is actually going after funding for additional cash transfers for the entire community, because again, we're in a place-based model focused here in Southeast. And so we're hopeful that that folks are going to support that, but was really happy to hear Jim talk about cash transfers and just economic recovery in general, and everybody on this call, because at the end of the day, our community was already, again, $34,000 median income was not good. And COVID is not going to be good at all. And there's so many people who not only did they lose their jobs, but their jobs aren't coming back. They're just not coming back. And I think that we have to be realistic about that. We have to think about, as Rada talked about, and she and I have talked about this, education and training. And if your job's not coming back, what are the transferable skills? What are the industries that are coming back? How can you learn or upskill so that you can do that? Because otherwise, you're going to have entire communities that get permanently left behind because one person ate a bat.
Thanks, Kim. We get to move on to audience Q&A now, and thank you all for the great questions that have come in. I've been looking at them, and I think in the interest of time and trying to get to as many as we can, I think I'm going to cluster these in hopefully 3 groups if we have enough time, but at least one that's more DC focused and then one that has a little bit more universal take to it. So for the DC questions, there are 4 I'm going to read, and then Carrie and Rada and Kim, if you want to answer however makes the most sense for you all. So the first one is, in the food bank, since many volunteers are retirees, how are you able to use those volunteers, or are you having to replace them with younger volunteers? And in general, how are safety issues with volunteers addressed? The second one is, how successful have been the local DC organizations in cooperating? What were successes or failures, and how can we be better prepared for the second wave, understanding we're busy with responding to the first wave? The third one is, what role, oops, nope, that's for later. Sorry here. Has the COVID-19 pandemic revealed any new insights and or dynamics about food security in DC? perhaps some that were not anticipated or were underestimated. And then finally, a great point about connecting to partners. What are the links between food banks and job search support for workforce development centers and the like? So I know that's a ton to take on, and if you could just touch on which pieces of those make the most sense, and we will start. Kim, you're still on the screen. Do you want to go first on these?
Sure. So I'll try to tackle them really quickly. We do not discriminate in any sort of category. So regardless of age, we certainly accept any volunteers who come. Everybody, we have the ability to provide masks and gloves. Again, we have very strict social distancing rules here, and it's monitored all the time for volunteers, especially, certainly also for our guests. Combining, so I mean, I don't know who's on the call, but definitely want to give a shout out to Jamila for thinking about us and including us in this conversation, and for volunteering with us. I hope she would also attest to the fact that we take care of our volunteers. But, you know, my background is actually education and workforce development. And I think that when we talk about things like food, we talk about housing, we talk about justice issues, we talk about health. I mean, a lot of times we have to get to root cause issues. And again, Radha and I have talked about this in ways that maybe we could partner with other entities around workforce, because again, economics is just really sitting in the middle of a lot of things. And in terms of the partnerships, I just would have to say that there are entities that have come together in ways that I never expected. There are entities who have supported us individually, and entities who have just said, hey, we see you guys out there, what can we do? And it's just been so humbling. I mean, it's one of those things like in your family, people come together for like weddings and funerals. And it's just so terrible that it takes a global pandemic to bring so many entities together and so many people together. But that's what we're seeing on the ground. I'm wearing my Love More shirt, and you know, it's a heart on the side. And that's just really what we're seeing on the ground. It's just so many people coming together, supporting one another. And again, just entities and institutions that may not have ever come together but for this.
Thanks, Kim. Radha?
Thanks. Yes, same on the volunteerism. You know, we are seeing certainly a lot of people come in. There's about a stable of 1,500 volunteers who still want to come in and volunteer. And in fact, we still need the volunteers, but we're also being cautious, like Kim and Carrie, I'm sure, in terms of how many we can accept to be able to ensure safety when people are here. What will happen more for us as we move into the summer months, we are a big purchaser from local farms. And so we will start to bag and box that produce. And with the weather better, we can also use the space that we have around the food bank to be able to do that. And as we start up many of the, you know, community market distributions, which were pulled back a little bit in the last couple of months, we will certainly need more volunteers there as well. So stay tuned on all of that. But many precautions are being taken so that we can manage the number of volunteers. In terms of the, you know, insights on food security or insecurity in this region, you know, we all knew that beyond getting food to those in need, you know, free food, if you will, just access to full service grocery stores and healthy food was really uneven across our region. And we knew that those, you know, who live in low income neighborhoods, those that have been traditionally marginalized, there have been racial and other structural barriers, you know, that have inhibited for many different reasons, you know, the ability to have full service grocery stores and just good quality grocery stores in many neighborhoods. We have seen COVID really shine a spotlight on that in a significant way. I mean, here we are, you know, being told, minimize your exposure, minimize your engagement, you know, outside of your home. And if you have to travel, you know, miles and miles and miles to go to a good full service grocery store, I mean, that just, you know, has heightened the issue of lack of access to good, nutritious food. So that is something that I think all of us, you know, and others in the community had realized before. And this is further highlighting the need to close that food access gap. because there are folks, as I mentioned, not everybody is unable to meet their food needs. People are working, they've got some income, just not all, that they will need. But even with that limited income, the choices they have are, perhaps stores that aren't selling, corner stores and others that may not have the best quality produce, meat, healthy snacks, those types of things. And so that is an issue that as we talk about rebuilding better, that is certainly a key ingredient of what we need to include. The other thing I'll just mention is as it relates to the other areas that need to be bundled with food. So education, skill development, many interesting partnerships, with skill development agencies, community colleges, that we may have never engaged in a big way before, that we have started and will likely continue, as we move into the recovery and rebuilding phase. That's important. We want to support people through their continuum. So it is no fault of a young baby, having been born into a circumstance, that is less fortunate, but through school feeding programs that we're doing jointly with Martha's Table in Ward 8 and other family markets. We want them to have good, nutritious food through school age. But then, we want them to aspire to go to four-year colleges or community colleges, whatever they can aspire to and afford, and to continue to have food be an incentive that allows them to enroll in those programs and stay in those programs is very important. We hear so much about students signing up for certification programs or college, but only having to drop out because the costs are just too expensive. Tuition may be taken care of for a first generation student, but not the other costs. So if we can assure them that they will have food, their families will have food while they are attaining that skill, that certification, that degree, that makes it all the more easier for them to be able to transition into living wage jobs that, in which they can contribute and benefit, from the growth that's occurring in our community.
Thanks, Radha. Carrie?
Yeah, just to, I guess I'll speak to the cooperation question. I've actually been just really impressed and really thankful with how the food and nutrition agencies in our area have been working together. I think we did it well beforehand, but I think we really are, as much as possible, trying to operate as one system. Our agencies address, people are food insecure for different reasons at different points in their lives, and we're all seeing an increase now, but we really are all working together. All three of the local agencies are on a call twice a week with different departments of DC government that are also doing food distribution work. We're sharing information. Food and Friends has been able to help a number of other agencies that have had to switch from congregate meals to delivered meals in order to reduce exposure. So we've done trainings on safe food delivery, no contact food deliveries, and that kind of a thing. We've also been able to make connections between restaurants and workers and agencies that are in need of food. Food and Friends has been supported by the restaurant community since we started, and there's a lot of empty commercial kitchens and a lot of out-of-work people right now who would love, some of that work to take care of other people. So I think, there's always more to do, but I do really think that, the agencies on this call and the ones that, work with us and aren't, really are trying to operate as a single system and addressing this really complex issue.
Thanks, Carrie. The next group of questions that I've got are a bit more on the international side, but there is a domestic implication as well. So there's one about asking about what convening, if any, is occurring inclusive of the entire food system of the public-private sector for food production, consumption, for response. And it references a webinar from yesterday. Another one asks about what kind of discussions or coordination within the international development community are happening to use economic recovery as an opportunity to build more inclusive and equitable food systems. And then finally, Mark asks, we've seen challenges to particular types of food production here in the States, such as meat processing, generally linked to labor-heavy production. Are there local organizations concerned about the ability to continue to source any particular types of foods? And on the international front, given the greater reliance on labor for food production, what do you anticipate seeing more widespread impacts? Can anything be done in the short term to protect ag laborers? And that's both in the US and around the world. Before I jump to Jim, I'm just going to mention two things that I know of off the top of my head. At a very high level on the food systems conversation, the UN is in the early stages of planning a food systems summit right now it's for fall of 2021. They haven't formally announced the date, but there is a lot of discussion going on at the highest levels and being inclusive in that conversation of smallholder farmers all the way through large producers and various types of public and private partners. The other thing I wanted to mention, just for folks that are interested more in sort of the looming global food crisis, the Alliance is co-hosting an event with FAO next Tuesday. I'll put a link to it in the chat box if anyone's interested. But that will cover some of that territory as well, from a little bit different lens. So Jim, I know you haven't had a chance to jump in on this last couple of questions, so I'll let you go first in responding to this set of questions around food systems and ag production.
Sure. I mean, and what I know in a lot of these things, as you had just mentioned, between FAO, UN, OFDA, USA, those conversations are still ongoing. So I don't know if the dust is really settled to a clear objective framework moving forward. I do know from the conversations I've had, be it with your fertilizer, Monsanto, even the government agencies that hold the private food reserve stocks, I think something that's matriculated over the last several decades is there's always been this kind of just-in-time food security, food sourcing from private sector. And I think there's also now more of a global awareness that there's going to be another, unfortunately, probably pandemic within our lifetime. And so I think there's a lot of discussions and hard conversations going about food storage, food locations, adaptability within the supply chains. Domestically, you've seen it with what's going on in the dairy and the meat sectors. It's the same thing in the commodities in these same sectors in emerging markets or outside markets. So I think that GIT will be amended, and what that looks like moving forward, or the emphasis placed on, it's a lot easier to do with cereal stocks, but how you look at it from a horticulture, dairy, and meat sector, I think there will be significant changes. And I think people are legitimately working day and night right now trying to figure that out. But that does seem to where some of the trend lines are going to. In regards to the labor, in regards to what's going on right now, I think one of the differences you'll see is there's the risk preferences and what works. I mean, if you ask anyone, we're primarily about 90% of populations in East Africa, 60 to 70% are farmers. So, as we're doing the labor, those activities, you're just having farmers reorient their risk preferences, which they're used to doing in terms of crisis or food stocks. I think it's different now because it's on such a global scale. So it does affect the migrant labor force, but a lot of what you're seeing, especially now that schools are closed, you're just seeing households do if they're more on farm, farming as a family business. Instead of selling more to the markets, there's going to be more increase in terms of how food systems are stored on farm, either using hermetic storage or using kind of these indigenous methods moving forward. And that's something we're seeing moving forward. I think in the US, there's a lot of concern about that as you continue to go forward with, there's already been a decrease in the food labor markets, farm hands helping in the labor markets. I think some of those are still unsettled, but on that emerging market, I think that's where they actually are a little bit better positioned because everyone at the end of the day is a farmer. So while there might be less commodities going into the market that you'd see in a normal economic environment, these are changing. So one of the things that might begin to take hold, and for the East Africa community, we'll see this over the next couple months, is that there's more food on farm, there's more food on farm, there's more food at the household level, there's less going to the millers, and then from the millers, there's less going out. And that, again, will always circle back to cash. And so how is the money circulation with less of these things moving through? How's the cash flow? What's going on with that? And that's the point too, I think, where we go back to cash transfers or grants or loan programs in terms of the resiliency effect. And as market contractions or recessions hit, how are you funneling this money in to make sure that not only it's really effective in the short term, but what are you doing to change it in the long term as well too? So I think I answered most of those questions, but I can hand it off, or I'll hand it off for now and see if I need to circle back.
Thanks, Jim. I think that was great. And I'll, the same questions around food systems conversations to Carrie, Radha, and Kim, but also with the idea of sort of urban production and, community gardens and backyard chickens and, more locally sourced, locally produced food for consumer purchase and consumption. I don't know if there are any conversations going on there. We have just a couple minutes before we need to get to the last question, but wanted to give you a chance to jump in if you know of something exciting or innovative or see an opportunity there that you'd like to share with the group.
If I'll just jump in to start here. I think that there are a few things that we're seeing. I think one thing that's interesting that can connect kind of the global efforts with the local efforts would be to use the SDGs. You know, we haven't really talked about that. And with SDG 2 being so focused on food security, I think there's a really interesting time to ensure that developed countries, for which, you know, we're meant to be included as well anyway, are playing a role, because we're all seeing food security now in a different light, if you will, through COVID than we ever have before. So being able to, you know, look at that and look at some of the indicators underneath that and track against those in terms of what's happening in developed countries as well as developing countries, I think would be very interesting. At the more national and local level, from a sourcing perspective, you know, we, and I think many large food banks and others in the area have always looked at national level buys as well as local and regional level buys. For us, the growing season here is really roughly June through, you know, November or so. And so during that period of time, we're very focused on purchasing locally as much as possible, both for all the reasons we know, freshness, things like that, but also to support, you know, the local economy. So that will continue. What we are hearing from farmers is, you know, one, they're thrilled that we're going to continue to purchase and purchase probably more than we have before. But second, they are seeing wait lists for those who are getting the CSA boxes and things like that. So I think it is shifting also how we purchase, you know, and where we purchase from, and the notion of being able to get direct from farm for so many reasons, I think is going up. So in that sense, I'm hopeful that for regional farmers, this is actually a good story, you know, and one where people will value, you know, the role that they can play moving forward. Just very quickly on the meat and dairy issue, yes, you know, we are probably more confident in the produce supply chain than we are in the meat and dairy one at this point. And we are still working through just ensuring that there's sufficient quantity of meat, but also that it's good, you know, and that we don't, this is where we do have to be careful in terms of quality control and what we are getting. And we're working both privately through, you know, consolidation of food banks and how we purchase, but also through USDA. Given the coronavirus farm assistance program, there's $100 million a month that is being made available in each category of produce, meat, and dairy. It's just the meat category is a little challenging because it's pre-cooked. It's often kind of higher sodium products, think hot dogs, you know, and so we are less interested in availing of that particular product line, and we're advocating, you know, with USDA to be able to make that just regular frozen cuts of chicken and turkey and, you know, those types of things as well. So, but we are hopeful that some of the supply chain challenges we've seen in the last couple of months will be remedied, and that we should be okay as we move forward.
Great, thanks.
Rebecca,
Carrie,
sorry,
yeah, go ahead, Kim.
I have to. We're taking like 1,000 some odd pounds of a delivery that's coming in that I actually have to go be responsible for. So I'm so sorry I have to jump off early. I just want to thank you guys for the conversation. Thank you for including Martha's Table. Again, we are open. We agree with everything that's been said. Cash transfers are amazing. Everything is jumping. Demand is increasing exponentially. Supply chain is going to be an issue. We're 40 years old, but we're 40 years strong. Thank you guys so much.
Right, Kim, before you go, real quickly, 30 seconds. What can folks do? The individuals that have taken this time with us during lunch today, what can they do?
Well, thank you for asking that. There's two things that we really need. We need people power and we need financial power. So again, the food doesn't just magically appear. We procure the food. So as everything is jumping and jumping and jumping, we have to buy more and more and more that's not budgeted for. $10 actually pays for a bag of groceries. So it doesn't have to be like some people think, oh, I don't think of myself as a philanthropist. You know, I can't give thousands of dollars. $10 buys a bag of groceries. And then people power. For those who are interested in volunteering, again, Monday through Saturday, we have opportunities, and actually 7 days a week, given our McKenna's wagon. We're open every single day. And so people power and financial power. Again, thank you guys so much.
Thanks, Kim.
Thank you,
So,
Kim.
let's take that question to the other panelists, and I'll share some thoughts as well. Jim, what can we do?
Well, I think, I think from what we're going to see moving forward, I think safety and quality, both of staff, but also of food processing and handling moving forward, be it use of PPE, everything, how you practice social distancing or how you engage from a food production standpoint, and how that goes through the distribution channels. I know for grants, we've already done these type of activities in terms of food processing and handling to try and mitigate spread. And in fact, I think some of those, where they've been a little bit ad hoc or they've been talked about, I think people take those seriously now. And so I think the continued reinforcement, so, as people become more comfortable, or perhaps as you start seeing the pandemic or the flattening of the curve slow down, people don't go lax in that. So to make sure that those best practices are still enforced moving forward. I think engagement with the private sector and storage and how those work, I think there'll be shifts in that. And so not just with cash transfer, and we do know historically people are using that in the appropriate ways, but I think a little bit of how private sector that has these grants is to manage them, to see what they're doing moving forward. On the development level, I know we'll do a lot more with local savings programs, or what's called village savings and loans associations. So while there is a liquidity crunch, both from large scale financial institutions, but to ensure resiliency at smallholder village levels, to do these kind of local saving groups that have historically proven to be effective. And the most recent case in Sierra Leone, Liberia, there was a lot of these programs that helped keep liquidity and cash circulation within the community moving forward. So I think the promotion of that, or perhaps even some adoption in the US or within these domestic communities that are particularly hard hit, I think some of those things might be good as well too. So that's that.
Thanks, Jim. Carrie, we'll go to you next. For the folks, again, on the call, what are some things that they can do as individuals, either through their work or with their own personal time and talents?
Well, yeah, just to echo Kim's call to donate and volunteer, really the best way for you to make an impact is to put your money and your time in the hands of the organizations that already have a solution to the problems that you want to solve. I think, there's a lot of experts on this panel who know how to make a pretty big impact with your time and your treasure. So please do think about that. I think all of us who are doing fine today, May 14th, need to really take a hard look at our own philanthropy and what we want to do for the people around us, because that needle is moving. If you're not looking at the world you want to see, you have to pay for what you want, just like anything else in life. So please do think about that, because there's only more need out there, and we all can do more, and we need to do more. I think on the advocacy front, we need to open up access to programs like SNAP. Block granting and work requirements do not make sense. In this environment, tying health insurance to employment does not make sense in this environment. And on a more specific note, there's a bill that's going to be introduced, hopefully in the next round of CARES funding, that expands access for medically tailored meals in Medicare. So, I've talked about how healthcare and nutrition are linked, and providing people with the right nutrition does lower healthcare costs and improve outcomes. And so we've got to, those two things are tied, and so we've got to treat them as, one system of care.
Thanks. Radha?
Yes, I mean, I think Kim and Carrie have said it. So please donate, please engage to support any of these organizations that is really trying to do, a lot in the community. On the policy front, yes, let me second the SNAP provision and the increase in SNAP. So SNAP, covers roughly 2, maybe 3 weeks worth, depending on family size, of their food needs. There is a gap there. And yes, all of us as nonprofits can come together to help address that. But what we do, it pales in comparison to what the government can do. And so with a 15% increase, which is what is in the House bill right now for SNAP, that is so important because that's 15% more dollars that go to grocery stores that help fuel the economic activity here. So that is super important. So if you can just reach out to your representative to be able to say they should be voting to include this within the next package, that would be important. I think the other thing I would emphasize is that, as we think about recovery and rebuilding, we're all quick to say it, but when those meetings come together and the working sessions come together, not everybody is at the table. And I think if this has shown us anything, please look around the tables and the forums that you're in and say, who's not here, who should be here, or we shouldn't speak on behalf of those who aren't. And so who are those organizations that maybe traditionally were not at economic development tables, but really should be, because a large swath of the population, whether it's here or whether, you know, it's in Accra, Ghana, right? I mean, they need to be at the table to be able to talk about, you know, what we need to do. So please ensure that as you are engaged in conversations, you look around and request that others who are in support of the vulnerable and low income and poor are at the table as well.
Thanks so much. And I'll just build on that. On the Alliance to End Hunger website, we have a COVID-19 resource page, and part of that are advocacy opportunities. The biggest one right now, as Radha and Kim and Carrie all talked about, is supporting the SNAP increases. It's a 15% increase to the maximum benefit, increasing the minimum benefit from $16 to $30, and then stopping any harmful rulemaking around work requirements or other problems that have been in the works for a while. The HEROES Act bill that Speaker Pelosi has introduced includes all three of those, along with some other provisions that would help individuals and families most in need get access to the food that they need to feed their families at this important time. We are hoping, and unfortunately it's not in that bill, but there will absolutely be an international ask as well for additional aid funding, particularly around food security. And so our website will stay up to date with opportunities around that. But you know, for those of you in DC, I know Eleanor Holmes Norton would love to hear from you, but others in DC or Virginia and Maryland and elsewhere, you know, your senators and representatives need to know these issues are important. So don't be shy in letting them know. With that, I'm going to turn it back to Paul to close and just thank everybody for being a part of this. Paul, thank you. This has been really great to be a part of, and I appreciate you and your colleagues pulling this together.
Great, thank you, Rebecca, and thank all of you for Carrie, Radha, Rebecca, Kim, Jim, for all coming and speaking with us today about this very important topic. We really appreciate it. I know it's not what we normally do, as we said, but I think it's very timely and a necessary conversation. So I appreciate all of you taking time out of your schedules. And again, as I said at the top of this, thank you for everything that you're doing right now in your response to COVID-19. One last announcement from us. We have dropped a survey into the chat box. We really would appreciate your feedback if you have any comments on today's event or just how it went, on the formatting, topics that we should be addressing. We really would appreciate any feedback that you have for us. So that's in the chat box now. So feel free to click on that and fill that form out. And with that, I will just mention again that we do have two other events coming up over the next 2 weeks. One next Thursday and one the following Thursday. So that's May 21st and May 28th. So feel free to sign up for those. And again, we will have many more events coming up, as we always do. So thank you for your time, and I hope you stay safe, healthy, and sane during these crazy times. That's it. Thank you.